station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
All right, welcome to Bobo. This is a special segment that we have done to honor HSA. It's a special segment just dedicated to all things HSA, where we speak to doctors, the admin staff. Maybe an event is coming up, and we want you to know more about it, right? We always want to educate you. It was a privilege to attend the primary health care awareness event that they had at the John Gray Gym, which was remarkable. I ended up taking a screening, and I was told, I'm going to talk to the good doctor that's here today, just what my results were. And it has a lot to do with the topic. So I kind of want to dig in deeper. We are talking about kids today, but I do want to include myself selfishly because of just of some of the feedback I got. But ladies and gents, Dr. Swan is back here in the studios. And I know him pretty well. He's been here once before, but I've also heard wonderful things about him here in the studios and just with the staff of HSA, especially with Monique. She speaks highly of you, Doctor. So for those that don't know you, let's give them a short bio on just who you are, how long you've been with the organization also.
Okay, good. I'm with the health services. I'm a consultant pediatrician. Did my training in pediatrics at the University of the West Indies. I've been a pediatrician for close to 18, 20 years, but I've been in practice for close to 25 years. So I've been around for a while. I've seen thousands of children in my career.
Oh, man. Is it a job that you enjoy?
Enjoy it. I would not give it up to see adults. I want to stay with the kids.
What is it to you? What is it that you find that you enjoy more than dealing with adults versus kids?
Kids, they are honest. They are for real, I say. That's the word I use. They're for real. There's no, hedging and no pretense with children. When they're unwell, they're unwell. You can see it. You can hear it.
Yeah.
And when they're well, they're well. They play and all of that. Not like us adults, we pretend and we fake it and all that. Children are for real.
Yeah.
They'll come in the morning and they look very unwell. And by evening, they're playing, they're riding their bicycles, their toys because they're feeling better. They're for real. So it makes, So sometimes people ask, pediatrics is difficult because children don't speak.
Yeah.
They don't talk. They can't tell you. But, by their actions, they speak louder than their words. And they're so innocent. And, they're good.
This is always something that you wanted to do growing up or just kind of just fell into it?
Actually, I liked vet medicine and agriculture sciences, veterinary medicine and all of that. I was in, but I fell in love with pediatric medicine later on, and I enjoy it. I wouldn't trade it in for anything.
Amazing.
Pediatrics is, and dealing with the children. Yeah, awesome.
Doctor, there's a lot of hospitals here, a lot of medical centers. What do you think make HSA stands out against everybody else?
HSA has been the primary healthcare facility on this island for decades, many, many years. And it's the largest organization, healthcare organization on the island with over, at least in terms of physicians, over 100 physicians, qualified physicians. We are a consultant-led organization, specialists in different areas, consultants, and a real good support staff also in all areas. HSA, primary health care, prevention, we are doing that very well. Very important because often we look at tertiary care and treating complications. But in the Health Services Authority, primary health care, prevention of illnesses and disease is also our focus.
Yeah, that's good. And I love that. I've been interviewing you guys. I think this is going on. This is probably my sixth interview. Yeah, 6 or 7 interview with HSA. And I've been educated on a lot of different functions that you guys have at the hospital that I just did not know about. And I think that's why this show is extremely important, because we get to educate, but also give awareness for different departments that the HSA serve. So today we have the privilege and the wonderful opportunity to be talking about obesity and childhood weight issues. The reason this is a very good topic for me to address today, I always seem like it's always at the right time, because as I look now and I see what kids are doing and parents and the lifestyle that they're living, it's a very stressful lifestyle. We have to learn how to read the room, right? So a lot of parents today are working overtime because it has to do with the economy. The bills are not good. They have to stay out later. And a lot of the times, I joke about this a lot, doctor, but I'm like, it's easier to just get the fast food.
Mm-hmm.
So much easier
It is,
than to
actually.
prepare a healthy meal. Now, I know that sounds lazy, but it's going to get us into the conversation today, and it's also going to insert me in certain ways. So let's start off by childhood obesity. Is it really a common issue here?
It is a common issue here in the Cayman Islands, and it's a common issue worldwide, increasing worldwide.
Yeah.
And I should quickly say, very often, lots of the things we see here in the Cayman Islands, we see it's a picture of what happens in the world also. And I don't think, so really we should be concerned and alarmed, but we also must know that it's the reality of the world as a whole.
Yeah.
And there is nothing so bad about us that, we're worse than the others, so to speak. I mean, we have to take into consideration and take stock of where we are.
Mm-hmm.
But we must know that these are challenges worldwide. And we are just like a microcosm of what's happening out there in the world.
Yeah. Yeah, it is. It's very true. And that's what I want to ask you, right, is because I said earlier, a lot of parents are finding it easier to just go and just say, you know what, today I'll just do the burger, or today I'll just stop by and get even a Subway sandwich. Hate to say that, but even a Subway sandwich or Subway can be considered unhealthy. They promote, being healthy, but there's some things that kids are having there that you have to say to yourself, this is a constant thing. This is also not where the road that you want to take them down, right? Let's talk about what's feeding these kids to be unhealthy. We want to talk about, there's a lot of different functions that we can talk, but let me talk about lifestyle first, right? Kids today, when I was growing up, it was the most wonderful thing for me to go outside and play a game of Zorro or Pink Panther or whatever it was, or Cops and Robbers. Now, YouTube is the number one functional tools for kids.
Yeah.
Let's talk about how that is a disservice to their health.
Right. Yeah, definitely. The sedentary lifestyle, lack of activity. Obesity is a problem of energy balance.
Yeah.
Intake versus your expenditure. And years ago, as you mentioned, Dan, your expenditure was quite significant. You ate, but you expended that energy.
Yeah.
So there wasn't that imbalance of energy. In today's world, however, because our activity level and our sedentary lifestyle is not keeping up with our intake, we have that imbalance, energy imbalance, and which leads to obesity, energy intake, carbohydrates, and fat, etc. So is that sedentary lifestyle, the new world in which we live? So that energy balance, if we look at it from the food, the intake, what contributes to it also is very often like the fast foods and all of that is, as you mentioned earlier, convenience. Really, it's such a fast-paced world.
Yeah.
I mean, we're heading to Christmas already, right? We're almost Easter. It's a really fast-paced world. We are working, we are moving. Parents are all busy people. And sometimes grabbing that first a burger and a pizza in the evening, that's all you can do to save a child's life sometimes. Yeah. It's the reality. There's always a place for that, but you don't want to make it a lifestyle. So the energy imbalance in terms of intake, and many places it's cheaper to get. You can get some fresh vegetables it's easier to get some fast food.
Yeah.
And with that imbalance, which also not just about the weight, but also things like hypertension and diabetes, other additives and other unhealthiness about these foods. And then the lack of activity. We played as children running outside, jumping, playing marbles and skipping and dancing and whatever. And in today's world, why is it safe out there? Is it traffic? The accidents? Is there somebody troubling children out there, abusing them, etc.? Kidnapping, whatever is happening. And these are something, is the environment safe for the children and all of that? And are there playgrounds close by? They have to cross the road to get to a nice little playground? Are there enough, etc.?
Yeah.
So these are the things that are feeding into the problems of obesity worldwide. And we're seeing it here also in the Cayman Islands among our children and our adult population.
Yeah.
What is really happening throughout the world. There's some countries that are doing better when they look at that balance and cut back on the foods that cause it and get more activity. So they work on that energy balance, intake versus output expenditure.
Yeah. Yeah, there's kids that's definitely taking a lot of the intake, but when you look at their outtake and what they're working out or just going outside to play outside, it's not happening.
Yeah.
And it's sad. It's even something that's attacking me, I'm not ashamed to say, in my own household, because I work around the clock a lot of the times, and I find that, I don't like the lifestyle that we're living here, and we got to figure out something. So we've taken up pickleball. Yeah. And sometimes I'll take my my son out to play ball, and it's been a massive improvement within the house. I think it was just yesterday we broke our rule of fast food. Right. My wife accidentally forgot her wallet. Yeah. She only had $25 in the car, and she found that it was more reliable to just go, or easier, to go to Popeyes. And it just broke a trend because it was the easiest thing. And I always try to say, let's do the hardest thing, because there was this quote that I said to somebody, just came out of my mouth. Don't know what happened, but somebody said, man, but good food is so expensive. Like healthy food is so expensive. And I said, so is cancer.
Absolutely.
So is
complications of those things. Yeah.
Yes.
But it's a challenge for all of us as parents. It's you're going home in the afternoon and your son is hungry or your daughter hungry, and you got to make that extra effort to say, oh, there's something cooked at home. Yeah. I always tell people, try and eat some home cooked foods, because it's sort of minimizing that fast food. That home cooked foods. I advise even cooking on weekends when we can, because we're so busy during the week. I mean, probably on Saturday or Sunday we can cook something, do a little preparation, and let the kids sit around and learn to eat, rather than eating on the go as the lifestyle the world is in right now. Yeah. But it is a major, and what happens in children in terms of weight and obesity can move on and cause challenges in adulthood. Wow. And we know the problems of weight in terms of even arthritis and leading to diabetes, hypertension, predisposition to cancers, etc. And then even the mental challenges, psychological, in terms of bullying and depression and how you feel among others, etc. So it has both physical and mental challenges. But we can work, and I know we're in political season always, and look for what our representatives will do in terms of minimizing the intake of fast foods and making more healthier foods accessible and available for all of us, from children to adults, and also making more provisions for activity, whether a field, green fields, open spaces, walk areas, cycle tracks, etc. And it calls for persons to actually make those decisions, representatives.
It's so true. Let me start by just giving the parents the reality here before we go to our first break. What is the risk? Like, what are kids risking here? Obviously the obesity is one, but what are kids jeopardizing or parents should be aware of when it comes to this?
Yeah, I mean, it's your entire life, really, basically, because it leads to lots of challenges. Obesity with all of its complications, diabetes, which is type 2 diabetes, we call the adult onset one, which we're seeing in younger and younger children now because of the weight issues. It's younger and younger school children are having type 2 diabetes because of the weights. Earlier, predisposition to malignancies or cancers. Earlier puberty, we are seeing children are maturing much faster because of the hormonal challenges that you get with obesity. Hypertension, also some significant issues. And then we said that feeds into lack of activity and things like arthritis and the mental and psychological challenges that go with it. The population, it's at an individual level, it is significant for our health, but it's also significant at a population level in which you have a healthy population or an unhealthy population.
Yeah.
So at an individual level, it's important to each one of us, and also at a population level.
Yeah. Yeah.
In terms of costs for health care, etc., significant. The complications, heart disease, etc., significant problems later, which can damage your economy, access to health care, etc. So it has profound implications.
Yeah. Let's discuss mental health. Big topic. Matter of fact, we recently had one of our first ever leaders debate last night with the chamber. And one of the topics that they addressed was young youth mental health. The reason that this one is really huge is because I think politicians are asking the question. Government officials are asking the questions, and parents also. What's going on with our kids today? Why are there so many mental health issues? And I dare to say, I'm not an expert, but the way that we consume food, I think, has drastically changed. I come from a background where my parents always cooked. When I got home, I know there was a good home meal prepared in the microwave. Even if I was late from basketball practice, there was physical activities I was also doing. And I was consuming the right food. There was less junk and more of a healthy intake, a balance. So lifestyle or reality or experience will tell me that part of it, I know there's obviously other elements, but I dare to say that I think food plays a drastic element in this when it comes to why kids are because the processed food that they're eating.
Mm-hmm.
I've read books that this can cause depression, that this can cause mental issues.
Right. Honestly, yeah, definitely. Your nutrition is also important. As I tell some parents sometimes, I don't think you can do good math and science on pizzas and burgers.
Yeah.
I mean, that's how I put it simpler.
Yeah.
I don't think you can do good math and science on pizzas and burgers.
Well said.
I mean, you need the minerals, you need vitamins from vegetables, from fruits. You need good water intake, adequate hydration. So it's all about your nutrition. And certainly depression, poor nutrition leads to depression. It's part. The toxins from the food, the sugary foods, the additives. Anything has lots of additives, fast foods, whatever, and foods in cans and tins, etc. Lots of additives. We are seeing that, in fact, the same. Very often, some of the kids who are having significant challenges with weight also have challenges with learning sometimes because of that connection between poor nutrition, which also impacts your mental health.
Yeah.
So it's really significant.
Yeah.
And we need to, when I look and see other fast food places opening up without a green space or a field, you realize, boy, we're not doing so well. Should have had a field there or some green space to go and walk or sit out and read a book or something to relax our mental health. You can sit in a park or something rather than having another sugary, food or something fast, something there.
Yeah, I agree. I support that. Listen, let's talk about what we can do, what we can replace today. I know we're talking about like the outcome and just how bad it is, but how can we try to change if there's parents listening right now? What do they have to take less of? What's the lifestyle change that we have to look at here?
So in terms of nutrition, we have to make a concerted effort to do better as parents. I say parents because I look after children, so my bias is towards children.
Yeah.
I always say the only problems children have is their parents. And I can say that because I'm a parent of 4.
Yes.
So I can say that. And I know my own, challenges. So the truth is, so as parents, we have to make that effort to change and do differently in terms of our eating and what we buy for our children. Things, fast foods from the freezers, warming up things, a quick burger, pizza, quick food, sugary food is not it. We have to make that effort to do some prep, some home cooked foods. That's how I put it, to differentiate, just home cooked foods. The more home cooked foods you can eat, I think it's the better.
Yeah.
In places they call it slow foods or slow cooked foods, etc. To differentiate from fast foods.
Yeah.
But what it actually shows is that you are eating healthier in terms of fruits and vegetables, and you are minimizing additives and sugars and lots of unhealthy things in your diet. So home cooked foods as much as we can. And we all like a little, treat. You can have a treat, little pizza party, whatever. But it must not be our lifestyle. It must not be the main thing. I have seen over the years, Dane, that I think I'm seeing, and even, whether you believe in creation and evolution, but evolution in this context is how things change. So don't take me. I believe in creation, whatever, or you're a Christian country.
Yeah.
But the taste buds of kids have evolved over the years. I've seen that. Children can hardly tolerate certain vegetables. Yeah, some of them not eating, pumpkin, callaloo, eggplant, some basic things that you take for granted.
Yeah.
They can't tolerate it. It seems to be, and a lot of this is due for that conditioning from other foods with lots of other chemicals and sugars and additives. And it seems as though it's conditioned these children's taste buds too.
Yeah.
In which, vegetables and fruits become repulsive almost.
It does. It does. We started off with our oldest boy. We started off with, my wife was really good. She fed him nothing but vegetables, so much so that it's become something that's normal for him to eat. So every so often, because he's into sports big time. He's even attended a sports school in high school overseas, and every so often he eats vegetables like it's a snack. So it's become a habit to him, right? But we find that because we got busier, that our youngest son, it's the most disgusting thing that we have to put some form of element, whether it be cheese or something on a broccoli, in order for him to eat it, because it's just become like, what is this?
Is that last child or young child syndrome?
Yeah.
We give them too much leeway.
Yeah.
And we cuddle them a little more than we did to that first one, etc.
Yeah.
And then they get away with that little extra treat, and then it becomes a lifestyle. And then when you want to, it's always you're absolutely right. I had some Naseberry on the counter this morning. I ate some, my wife ate some, and it was a struggle for my son to eat the Naseberry. I understand fully what we're up to in this
punishment
in today's world. Yeah,
it can be considered punishment. Great talk. We have reached the end of our first segment. Don't worry, folks. We got 2 more segments left here. We'll be right back. This is Bobo, and this is a special segment all dedicated to HSA. Today we are talking about childhood obesity and just how we can kind of help you as the parent and the child to make a lifestyle change. Keep it locked. We'll be right back.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
And we are back on Bobo, show dedicated to all things HSA. We have a good doctor in the house. Doctor, why don't you introduce yourself once more again, just for the listening public?
Sure. I am Dr. Linden Swan, a consultant pediatrician attached to the Health Services Authority. I've been there for over 18 years, and I'm working as a medical doctor for over 25 years.
So we are going to move on very soon. We were talking about childhood obesity, but we will move on very soon. I just want to get some more points because it's such a good topic to allergies and asthma. But let's talk about let's wrap up childhood obesity just for a second here. I was telling you my story I wanted to insert, which I did a health screening at the primary health care awareness event just recently last week on Saturday. And, when they did the blood work and they came back, they said, well, this would consider you obese. Like your obesity, you fit in that category, right? And also be concerned about your sugar intake because this could lead to diabetes. Those were words I did not want to hear. And also it made me very scared automatically as a parent to my kids. And then I immediately, it was like a light bulb went off in my head. Immediately I wanted to change the lifestyle. Automatically we went to the supermarket that same day. We picked up healthy fruits, lean meat, protein, different things that we can eat, even watch the flour and the breads, the different type of breads that we eat and stuff like that. It was like an automatic shift. Like my wife got rid of so many stuff in the house. If it's not there, we can't eat it, right? Yeah. Saw her just took a bunch of Oreos and just and chips and just poured in the garbage. Felt all that money going in. But I like the cold turkey that we did. It was like, no, we have to fix this now. This is a lifestyle that we have to change now. It made us very concerned about even our younger son, which I was talking to you off the mic about. But that word, it's such a difficult word to hear, especially here in the Caribbean, because I feel like we come up with this narrative, and I'm not insulting anybody, but this is what it means to be Caribbean. So you don't even listen to the word obesity. You say, this is what it means to be Caribbean. I'm just big bone. I'm not fat. I'm not obese. Can we kind of wrap that up? Just to give more awareness on that, because Caribbean people really do look at it like it's not an issue.
Right.
Just your word, not mine.
Yeah, and it is an issue, and we all should be aware of that, cognizant of the fact that it is an issue, and don't make it the norm. And that's one of the things I remember the chief medical officer after the STEP survey, which showed significant challenges in the population with chronic diseases. And we have running the risk of trying to make that the norm, obesity, etc. Again, not just in the Cayman Islands, but worldwide. Let us not make it the norm.
Yeah.
Similar to see also, not just heavy people are unhealthy. You can be slim looking and good looking and still be unhealthy.
Yeah.
So, and I know my heavier friends always tell me that too.
Yeah, it's true.
But definitely. And, sometimes we have to look at how we deal with the topic and how we address it to give hope, because we don't want to lose hope. We don't want parents to lose hope. We don't want to lose hope. And so I look at it from activity. Even in my clinic at the hospital, I call it the activity clinic rather than obesity clinic, because I look at it from a positive perspective in terms of which these children just need to be active some more.
Yeah.
Get a sport. I always say find something to do. Netball, basketball, football, swimming, whatever you can do in your community. If you're heavy boned or big in size, tall, you can probably hit that ball out of the park.
Yeah.
So you can probably play baseball.
Yeah.
If you're faster and lighter, you can probably be running the 100 meters. If you're heavier in stature, your family history and stronger, bigger bone, you can throw the shot put or do something like that, but keep active. Dancing is a real cheap thing. Put on a video in the home, I tell parents. It's not expensive.
Yeah.
And if you're a Christian and you don't want to dance too much, put on some gospel or spiritual songs and psalms. I always say there's always something to dance to.
Yeah.
You don't have to dance to reggae or soca like I do, but you can put on some spiritual songs and some gospel and dance to that also.
Yeah.
There's always something you can do. And I always tell parents, it doesn't have to be expensive. You don't have to be signed up for some $600 gym. If you can do that, go right ahead. But it can be something walking around the neighborhood. Mm-hmm. It can be just cycling around the neighborhood, looking for the closest park, doing some walking in the evenings when the sun is cool. It is so hot these days. Early in the morning or late in the evening. There's always something you can do.
Absolutely.
We must not lose hope.
Absolutely. I love that. And that's a great way to wrap up. Guys, it's simple lifestyle change. Now, I gave you something that I did. You don't have to go that drastic. You can slowly pull away from it. It's in moderation, I like to say. But also, I do believe that, it was a good doctor once that told me if it's not in the house, then you can't eat it.
Yep.
Right? So if you have the apple, the fruits, and the banana, and granola, different things that you can eat that's healthy, you can have fun figuring out. And that's what we have figured out, that there's fun things that we can try and eat and spend more time as a family developing a healthy meal, because everybody gets in the kitchen now and we create these meals that we never knew about and just how good it was. We're having a time of our life doing it and just trying different things, right? And seeing what our taste buds is gonna take on. But thank you so much for that segment. Now we are moving on, obviously, to allergies and asthma. And I want to ask the first question, similar to the last one. Is this a common issue, and what are the main causes here in Cayman with allergies and asthma?
Yeah, we're seeing more and more. Years ago, we only saw like asthma and allergies running in families, so to speak. It's not like a genetic or an inherited condition. But we're seeing more and more children, they have no family history of allergies or asthma, and they're coming down with, asthmatic like symptoms, wheezing, coughing, etc. And allergies, we're almost not seeing, we call it dermatitis or eczema, so skin manifestations of allergies. And there's almost everyone with some skin manifestation at one time or the other. So we're seeing more and more challenges with asthma and allergies. Again, some might argue it's all the additives in our foods and all the chemicals in our foods. And others might, the environmental issues are also impactful, like pollution in some cities really have it more than others.
Yeah.
Significant pollution in which some people even wear masks, certain masks to filter out the toxins in the air. Luckily, we are still on a nice, healthy island here, and we can breathe some fresh air then. It's very important.
Yeah.
We should, probably sit at the beach more often and breathe some fresh air. But really, the environmental concerns, we know sometimes, like when it's pollen time, it's breezy and dusty. We see some children come down more with wheezing issues too. And then we also know that intake of certain foods, you might be sensitive to things like cow's milk, peanuts, and other additives in food. Sometimes we can't test for some of those things.
Yeah.
But we know that is. Those are some things we see. Soaps also, they dry the skin out quite a lot, can be harsh on the skin and cause significant skin problems. Those are some of the problems we see. So we live in a hot tropical climate. Moisture levels are high. Humidity is high.
It is.
I think most people are trying to get rid of carpets. So I don't know about your situation. You need to get rid of carpet. But really, carpet, it was a good thing years ago. But more and more we're seeing it's causing challenges. Or I don't know if you're eating the wrong foods and getting allergies and blaming it on the carpets.
Probably.
Probably. But environmental things are significant. Some people have their animals and their pets, and that might be shedding, and they can be sensitive to some of those things also. But we're seeing more and more problems, and you want to control children who are wheezing and asthmatic. When the viral seasons come around, like we're in the flu season now, and if you have any tendency to cough or wheeze, it takes a toll. It can take a toll on you. And it can cause you to end up in hospital or to the doctor or the clinic somewhere because you're so vulnerable. Your lungs are so vulnerable. Yeah.
You mentioned coughing and wheezing. Like, how can a parent tell the difference? Like, I need to take my child in because they perhaps have asthma. I didn't know before, but I just seem to, this is definitely not normal, and they're doing it way often than they should. What are the signs?
Yeah, I mean, any child who is really coughing and can hardly breathe, you wouldn't wait for that extent. And parents are very good at using their instinct and say, this is not my child. He's been really having a bad night, coughing all night. We see them next morning. And any signs of labored breathing, using your muscles to breathe, or can hardly speak words. If you're not breathing well, you're short of breath, you can hardly talk and all of that. That's a late sign. You don't want to reach there.
Yeah.
But excessive coughing is a sign that there might be some tightness in the chest. You might be wheezing, or there's some bronchospasm is a big word we use. And you will want to take your child. If your child is diagnosed as asthmatic, or you are diagnosed as asthmatic, you would normally, sometimes we give them a little chart in which you look for the zones, green, orange, red, and they will know which is the red zone to take their child in when they see certain signs and symptoms of labored breathing, cannot speak when they put words together, and using all their muscles to breathe, etc.
All right, that's wonderful. Now, and that's good feedback too, for parents to be aware, because we always like to ask those signs, because I think you said something really crucial: instincts. The minute you feel that, there's nothing wrong with setting up an appointment.
Absolutely.
And finding it out, because you know your child. You know your child. You've been around them, so you understand your child. Now, I think one of the biggest advice here is managing. If you go there and you know for a fact that your child has allergies or maybe they have asthma, how do you manage this here in Cayman? And specific for this environment, because obviously it's different in different eco-friendly, whatever you go in the world. But how do you manage it here in a tropical area?
Right. I mean, very often we can mostly manage the situations in our homes. So, dust control, pets, moisture levels. People will tell you sometimes they think they have mold. They bring in someone to clean their vents and all of that. So persons wheezing and having asthmatic problems. At an individual level, we avoid too much of things like powder in small children. Talc can go deep into the airway, and avoid strong odors, perfumes, etc. Infections are also important. So having your regular shots and staying away from viruses as much as you can, keep away from viral infections, because one of the common cause of wheezing and triggering asthmatic attack is viral infections. So we see a lot during like the winter season, when it's winter in North America and it's cold here, cold front and so on, lots of viruses. Persons who have a tendency to asthma or to wheeze or have asthma, they have challenges more. I should quickly add in terms of the children and wheezing, because a lot of times parents ask, is my child asthmatic?
Yeah.
And I say, whether the child is asthmatic or just wheezing or coughing too much, the management is the same. We want to sometimes nebulize them, give them something to open up that airway. And running to a diagnosis sometimes is not always easy. Some people like diagnoses, some people don't like diagnoses. I think sometimes some insurance companies don't pay your bills if you don't have a diagnosis. But then some people don't like diagnoses, and that's fine. If your child is coughing and wheezing a lot, you have a strong family history of asthma, you've wheezed 2, 3, 4 times, you have to use inhalers or nebulize, you're probably asthmatic, whether we say it or not.
Yeah, so true. And I wanna ask this question. This may be what some would call common sense, but we don't know. I haven't seen it, but maybe you have, because this is your industry. But can a child outgrow allergies? And asthma, those two.
There is that. It gets better as they in most cases, it gets better as they age and get. Some people never outgrow it, and sometimes it gets worse in some individuals. Yeah. But usually you can, like for the some of the allergies, like the food allergies, you can almost like develop a tolerance sometimes. And in fact, the treatment of, let's say, severe allergies sometimes is exposing that individual to small amounts of that in a clinic setting, a setting in which they can treat any emergencies, and allowing their body to develop tolerance to, increasing doses of that antigen, that substance that's causing the allergies, we call it. And that, so you can develop tolerance as you get older to some of these things that you couldn't eat. Somebody will tell you, I couldn't eat peanuts or shrimp when I was younger, but now I can tolerate it a little better. Sometimes it gets worse, though, however, and you cannot deal with it.
Yeah.
However, there's some treatments, new treatments, series of injections, etc., to allow your immune system to tolerate some of these things better. Especially some really severe things that can cause severe reaction, life-threatening, like peanut allergy and seafood allergies, which are notorious for causing severe anaphylaxis, we call it, in which your airway is affected and you can hardly breathe. And all these persons will have an EpiPen also and some antihistamine on standby. Yeah.
My daughter is obviously affected by shellfish and banana. Those are the two things she can't eat. So, and she loves a good comforters, but if she tries that, it's just going to cause an issue. So you saying that there might be things that can be helpful, is that something that she can try, like maybe getting injections or?
Yeah, I mean, it's good to see an allergist/immunologist. And sometimes you can try and see if you give a series of shots to develop tolerance, especially if it's something can be life-threatening. Yeah.
That's why I like these shows.
To modify the your immune system.
Yeah.
Yeah. But usually sometimes just trying to keep away as much as you can.
Yeah.
If you don't. If it's severe, however, that person should have EpiPen, epinephrine pen for an emergency.
Yeah, just in case, right?
Yeah.
I am learning so much from these shows. I go home a lot of the times, and I parents, my wife and kids feel like I'm a doctor at times, just because of different things that I'm saying or the feedback that I'm getting from you guys. So
I think you can become a doctor. You can have that title by now, Dan. You know,
I hope so.
So much by now.
I hope so. You say you become who you hang out with, right? Show me your friends, and I'll tell you who you are. But you guys have done this a long time. This is not just an easy walk for you. My daughter wants to be a doctor, and she just finished her master's. But the journey's going to be long. Yeah, she wants to do trauma surgery, so that's a different topic. But yeah, it's a journey. I've heard about the journey, so I do not envy you guys at all, but I do respect you. We're going to take a short commercial break, and when we come back, we'll have more discussions on childhood, different development, behavior, and so on. So keep it locked. We are Bobo.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Welcome back to the show, and thank you so much for tuning in to Bobo. Each week, we sit down with a doctor or maybe an admin staff, maybe someone that works in marketing, or maybe someone that's coming to obviously put on an event that has a lot of benefits to the HSA, and we get to educate you, the listener. So just driving right now at home, or maybe you have just tuned in for the first time. You don't know what the show is about. I want to educate you from the jump on what you're listening to. I like to say that these shows have definitely inspired me and it's definitely grown me, and I'm on the journey to a better lifestyle for myself. And I also get to learn a lot about my kids at the same time. There's different things that I am learning. Just, as parents, we're never really given that big book that educates us on how to do or how to be a parent. So we like to take in these information that comes in. It was a mentor of mine that said, Dane, there's two ways that you can do this. You can either learn from your mistakes, that makes you a smart man, or you can learn from the mistakes of other people. That makes you wise. I like to learn from the mistakes of other people and be educated by doctors like Dr. Swan that's here, that educates on his expertise, his background. And, I take it serious because he's seen so many kids. How many kids have you seen over your lifetime?
Quite a few thousands.
Yeah, it's been a lot. And I've seen you've seen so much. I think last time, Dr. Swan, I asked a doctor that was here, why don't you guys get emotional? Like, I always look at doctors as emotionless. Like, you go there and you talk to them about something and you're so frustrated. You come in with that emotion, but then you're like, you're not displaying that. Yeah. And they articulated themselves perfectly, but I want to hear your response.
It's called detached concern, actually, in which you're concerned significantly, but detached.
Yeah.
I think my residents, my juniors saw me with some eye water the other day when I was speaking with a parent, and it was quite a sad situation. But but you don't want to further aggravate the situation because all of you can't be crying at the same time. That's the truth. When it comes to emergencies, however, you have to stay firm. You have to stay calculated. So you have to do what you have to do, and you've been trained to do it. So you have to put away emotions. If you're hitting somebody's chest, you've got to pull somebody to do something. You just got to get it done for their life's sake. So it looks emotionless, but it's a lot of emotions because, and we have emotions. I mean, we have families, the situations, the economic constraints of people. Yeah.
Yeah.
So we do. But it's called detached concern, in which you're absolutely concerned, but you have to be detached
from that
situation in order to function properly.
Everybody's articulated a little bit different, but it's pretty similar. And I said to somebody one day when they mentioned something about a doctor, and I said, okay, I understand. Your feelings are taken into consideration and they're valid. Let me ask you this question. If a plane is going down, because I used to care about aviation a lot, wanted to become a pilot, even studied it. I remember saying to someone, it was the same thing, similar. They have to learn how to not panic in an emergency situation, right? And I've talked to so many pilots, and they've gone through these type of training. And I said to someone, "What do you want the pilot to do? To scream while you're screaming, or to take control of the flight?" Because he has to be, he has to do his job.
Yeah.
His job comes first, and his job benefits you.
Yeah.
Because it saves your life. Similar to a doctor. What do you want? Do you want him to cry next to you? Or do you want to figure out how he's going to save your son or your daughter's life? You know, vice versa. So behavioral, that leads us into that.
Absolutely.
That's the great segue. Behavioral challenges with youngsters and autism. Let's start by asking the questions. We've heard more conversations about autism and behavioral issues in the recent years. Yeah. It is Autism Awareness Month. Is that something that you're seeing more of, behavioral and autism amongst kids?
Yeah, autism, and there's increased numbers of children being diagnosed quite significantly. Some argue it's just because we are more awareness, but I think most of us know that we are seeing significantly increased numbers of children. Very, very frequently, you're seeing children with issues. From very early, children can have, and autism is what we call autism spectrum disorder. Spectrum, it's like a spectrum from one end to the next. You see children quite not just minimally affected with probably their speech and a little awkwardness, and right to a severe condition in which they cannot speak and their behavior is uncontrollable. So it's a spectrum from one very mild to severe, and therefore we call it the autism spectrum disorder. And we have children on that spectrum, from one end to the next. It can, from very early, we can see challenges with children with autism spectrum disorder. Some people think from just a fussy baby might be a first sign, a severely fussy baby. Now, I don't want parents to think colic is a problem, okay? But there's something difficult to manage and control. But usually when they get a little older, and what I mentioned there is about research mostly. I don't want parents to think if you have a fussy baby, in no way it means your child has problems. I talk about research. But really from about 18 months, we start doing some basic screening. 18 months to 2 years, we start doing some basic screening in terms of autism, children's speech, their socializing, and the behavior. Those are some things we look at, how their speech, the content of their speech and so on, and their socializing, social contact. And those are some things we do a little screening of very early, and we can have an idea that this child is probably on the spectrum.
Yeah.
Later on, that after that initial screening, you actually do, when they get a little older, you can do further testing with certain psychological tools, assessment testing, to confirm that diagnosis. Some schools are taught, versus American school are taught versus European, British school are taught, whether you need a diagnosis before you must start treatment or start therapy. In some systems, you start therapy, you start speech therapy, you start behavior therapy, you start occupational therapy. Even before you get that diagnosis, some people, on the other hand, is my child autistic? They want a diagnosis. Okay, you probably will have an assessment and then have a diagnosis by the child psychologist can use certain tools, or a psychiatrist or a behavior specialist, etc.
Yeah.
And then you can have a diagnosis. Whether you have a diagnosis or not, in pediatrics, we see sometimes children just coming into our office and you can see their poor, lack of eye contact, poor socializing, paucity of speech. And you have an idea that this child needs support. So long before you get a diagnosis, I'll send you to get some speech therapy, an evaluation, occupational therapy, and probably some behavior therapy. We can come to that diagnosis later.
Yeah, and I'm glad that you answered that, because that was our next question. Like parents knowing that something doesn't seem right, but there are steps. There are steps. We don't automatically want to give a label to a child. There are things. I'm glad that you said that. Speech therapy. Moving on. My younger brother back in Tampa had a situation where they all just kind of sat back and they were saying, "I think he's autistic. I think he's going through this." And when they took him to the doctor, they said, no, he's just, taking a while to develop speech.
Absolutely.
But he just needs a speech therapy. Same thing with my younger son. Same thing. He was just struggling with certain words.
Yeah.
Needed to send him to a speech therapy. But I tend to see parents I think it's fear that's doing it to them, obviously, right? Like I remember this situation where a young child was in a restaurant, and every time you took something from the child, it got very frustrated, and she started to make this humming noise. But I didn't want to come to, like, I realized the whole table all kind of look at each other at the same time. Was like, is that word without saying the word?
Right.
They were figuring that out, but I hate to jump to conclusions.
Right.
Yeah.
That's true. Yeah. It's not easy sometimes on families and parents, and we all must be sensitive to the challenges. Because in, the poor socializing and all of that sometimes. So it's good to, it's trying to find that balance between, on the other hand, you don't want to lose time if somebody needs, because the earlier you start to get the support, the outcome is better. Because the earlier the child gets the support, the outcome is better.
Yeah.
So it's trying to find that balance, making that diagnosis not too late and starting therapy. So, and not giving that label too early and cause anxiety and so on. And yet not waiting too late. And, in the first years of life, under 5, the brain develops so rapidly. You want as much input as possible with speech and language and behavior and etc.
Absolutely. We wish we could spend way more time on this topic. Unfortunately, we do have 2 minutes left. So I'm going to ask the good doctor to obviously just give a main message to the parents that are listening. What's your main message to parents today? Their big takeaway from our conversation.
Right. Commonly, in terms of chronic illnesses and challenges we see among children here in the Cayman Islands, obesity and weight issues, lack of activity is significant. Allergies and allergic problems, asthma is also a significant problem, and behavior problems, including autism and ADHD, are also challenges. But there is help, there is hope. And we must not all, whether it's from we're struggling with the weight or what, we can all make a change and for a difference. And we have the clinics at the Health Services Authority, the pediatric clinic.
Yeah.
Appointments can be made and we can deal with most of these challenges.
I love it. Dr. Swan, thank you so much for stopping by the Bobo studio today. And we appreciate you. We know that you are one that we always seem to get here in the studio. So we will see you again very soon. It's not goodbye.
Most welcome. Thank you.
Have a wonderful day.